Well, hi there. Greetings, my friends. Thank you for joining me today. And I do hope wherever you are, the life's treating you well. Today, I'd like to talk about my poor dentistry journey. Now, the title's misleading because I've had many dentists over the years dealing with my teeth, and some of them have been very, very good. I could name names, but I'm not going to name any names because of libel and things like that. But suffice to say, there have been some very good dentists. My dentistry journey started when I was fairly young, back in the 70s, as you might have imagined. I'm over 50 now. And back then, the idea was we had an NHS, which was better than it is right now, and it's hopeful. And the push was to get every kid starting school seen by a dentist in order to try and identify and treat dental problems, because before they became a big problem later on in life. And ingrained sort of good practice, good dental hygiene practices that we could all carry forward for the rest of our life, and hopefully, not suffer as our forefathers may have suffered. Now, the dental history within my family isn't brilliant. We're blessed in many areas, but not with dentistry. So how did I get to the poor dentistry that I've got right now? Well, as I say, it started young. So starting school, saw first dentist, and they said, yeah, well, you should go and see a dentist to get checked out properly. Looks okay, but go and see a proper dentist. The school dentist was never really much more than a quick look over, see, if you've got a massive hole or massive problems, maybe they'd do that on the spot. But my mum took me off to a Solihull dentist, and not the cheapest, not the most affordable, but there it was. We went off to see a Solihull dentist, and he had a good look at me. Now, at the time, I didn't have any tooth rot, and nor did my sister, by the way. We were both taken along to see the dentist, and he had a good look at me, and he says to my mum, well, he's got patchy enamel on the front. It's different thicknesses of enamel, and different thicknesses look different colours. So it's enamel tends not to be white. It tends to be more of it ranges from the whitish through to the downright yellow for some people. It's down to genetics. And in my case, some parts were thicker than others, so some parts were darker than others. And apparently that issue starts when you suffer from rubella, I believe, in the womb. That's what they think it was, but research might have found a different reason right now. But whatever the reason, and I'm not really bothered why there is a reason, the enamel was patchy looking to his eyes. Now, to my eyes, I didn't really mind. It didn't look bad to me, but the dentist decided that what was going to be done was it was going to be treated by grinding my enamel all the way off on my top front teeth. Mercifully, he spared the bottom teeth, mercifully, but that's what he did. So top front teeth, they were ground all the way down to pretty much the dentine, pretty much within a millimetre of the nerves, to the point when I could feel it as it was being done in the dentist's chair. I could feel the cold of the air in the room hitting the nerve. I could feel it even though I was numbed up with that nasty injection that they always give you. Wonderful, I thought. Yes, this is going to be so much fun. And then on top of that, they put the plastic veneer, which is much like the nail stuff you can get back in the day, and not much different. And it was UV cured, so he puts that on, smears it on to the best of his ability to give you a more or less shiny coat, cures it, and then polishes up to a fine finish. And you'd think, well, if it was strong veneer, that'd be okay. But it wasn't. It was the 70s, and veneers really weren't strongest. And if you put them on an incisor, and your canine teeth, these are teeth which get a lot of slicing forces, really. So along the cutting edge of the teeth, that's where I started to see this veneer chip away pretty quickly, within weeks, within months. And this would require me to go back, and he says, oh yes, I can fix it. I've got to grind it all off again, and we'll cover them again. And I got charged for every single tooth that was recovered, every single time, every couple of months. Now, there's a lot of months between age 7 and becoming an adult, and you can imagine the number of times that got fixed. Now, don't forget that during that time I was at school, so having time off to get dentistry wasn't the best. It cut into your days. It cut into my parents' days, taking me to the dentist, and And eventually it started to cut into me financially because, of course, when I turned 18, that was when they started to apply the real charges, when you had to start paying for your own dentistry. And it turned out it was like £50 a time, £50 a tooth. Okay, so one complete replacement would be, you know, 4 teeth. Yeah, £200, wonderful. When I didn't earn £200 a week, back in the day, you can imagine how hard. But this wasn't ideal. This wasn't ideal at all. It really did cut into my finances, and there was a point where I would leave it because I couldn't afford to have that done. Now, a chipped tooth like this, a chipped veneer, of course, starts to scratch at your gums, it starts to scratch at other teeth, it starts to scratch at your tongue, and all of a sudden you've got a mouthful of mouth ulcers and a bundle of fun that is. And combine that with any other ongoing dentistry issues you've got, like a filling that needs doing, again, which is another cost, and you've got a world of pain. So a lot of my education time was spent in some pain with some sort of dentistry, you know, that maybe could have been avoided had I not had the unnecessary dentistry to start off with. I would have been fine having had it done later on, when I was an adult, when I had the choice. Had it not been pushed as something very necessary when I was a child, it wouldn't have been done, and I wouldn't have spent so much money over the years. And over the years since then, I wouldn't like to think how much money I've squandered. I mean, I'm over 50 now, so, you know, go figure, you can probably work it out. So over the years, that's one area I've squandered money, absolutely squandered money. Now, NHS has 3 tiers currently. So the National Health Service here in the UK, it has 3 tiers of assistance. So in each tier, the government helps the dentist pay. It helps pay the dentist for the treatment, but you still have to pay something. So it's just looking at it. Maybe I've still got it on the screen. You can never know. Here we go. So you've got band 1, grabs glasses. Band 1 is for £26.80. It's a bit random, isn't it, that one? But it's for the inspections, minor stuff, x-rays, coatings, few very, very minor stuff. Band 2, that is £73.50 currently, which is fillings, some fillings, not major fillings, some fillings, root canal treatment, removing teeth, extractions. £73.50 though, it's an awful chunk to pay. Now, my dentist will take into account what you paid for the inspection, so you only pay the top up. So, you know, if you go into the dentist and you need a tooth out, then you'll just pay £73.50, not £73.50 plus the inspection charge for band 1. So there is that. And then there is a band 3. Now there's a whole bunch of things to do with these bands. I'm not going to read it out. You can check it out on the NHS website if you want to. Do a search for NHS dentistry costs. You'll find them. Band 3, £319.10, which is way out of a lot of people's league. That's for bridges and crowns and false teeth and things like that. And that having been said, a lot of the things you might want, like a crown, are extra, are private healthcare costs, and they can be very, very expensive. I believe my local dentist charges pretty much near £900. If you've got a better deal near you, do let me know in the comments. I would love to hear from you. I know some people have previously on other videos commented that it might be worth me going abroad. Yeah, you might be right. I still can't afford that, and I would love to be in a position of being able to do that. Maybe the channel takes off one day, but until that point I continue to lose teeth. The visit to the dentist, for me, I hate it when I go and I have an inspection and they start reading out numbers, you know, for the number of teeth, and every single time I go there's less and less numbers on that list. Yeah. Anyway, so had a lot of unnecessary work, and a lot of unnecessary work that led to more unnecessary work. Now, I've had dentistry done in the 3 sorts of dentists that there are. So, you know, there's primary, just NHS only, and they're very basic in what they offer as NHS and private healthcare offering. But you tend to see those sort of dentists still focus very much on the NHS only, because it gets bun through the door as quickly as possible and makes them the most money. It doesn't pay them to push the more expensive services, because You waste time talking to clients about that sometimes. People who ask for NHS treatment generally can't afford the private healthcare. And then there's the private healthcare, which tends to be the most attentive, the nicest healthcare to get for your dentistry. And if you can afford it, it's the one to go for. Now, there are some dodgy dentists out there. You speak to your friends, speak to family, speak to people you work with, get recommendations, go to the one that gets the best recommendations. But you still might find yourself waiting an awful long time to be seen, because a good dentist is always in demand, whoever they are, wherever they are. Now, I would like to see politicians do more to encourage people to get into dentistry and the various supporting aspects of dentistry, you know, the dental hygienists, the people who make your false teethy crowns, your all those inlays and veneers, things that got to be made by a private lab. I would like to see those sort of people encouraged to go and get the training. That training is very expensive when you take it at university, and a lot of people will be put off by the cost of a student loan, because it's only going to get more expensive, and you've got to not only the loan for your tuition, but you've got to get a loan for, you know, cost of living somewhere, renting, all that. I would love to see the government make it more like it used to be, you know, give better training at source, free at the point of delivery, you know, because it would pay us to have more dentists in this country. It would pay us to have better access to dental care, because if people on poor wages can get access to dental care quickly, they can take time off quickly, have something sorted at short notice, and go back to work and be productive members of society again. It doesn't pay anybody for us to be sitting there suffering, you know. Does it? You tell me. I don't think it is. I want to see less reporting. Oh, this politician took this payment. Oh, this politician got this suit for free. I don't care. I really don't care. I want to see politicians do more to get more dentists for the general public. That's what I want to see. I want to see more people encouraged to get an education, and for things to be put in place that make it possible to live and get that education without breaking the bank, without leaving them in student debt for decades to come. That seems reasonable to me. Yeah, that turned into a bit of a rant, didn't it? Now, more recently, of course, I do look forward to maybe getting implants one day, but even implants set you up for further cost further down the line, because I know folk who've got implants, and there's the cost initially of having the raw prog looking things put in your bones, and then the implant created for you. And in addition to that, you often have to have it cleaned professionally, you know, once every so many weeks, which is another cost. It's a cost of your health, isn't it? But if you could do it at home, well, wouldn't that be much nicer? But I live in hope. Maybe one day I'll be able to afford a nice holiday to get my teeth sorted out. But until then, I'm here telling you what I think. Anyway, let me know what you think in the comments. I do love to hear from you. Whatever you do, have a great day. See you soon. Bye for now.